We are doing oral histories for the exhibit that's upcoming, Celebrating Nursing in the Upper Cumberland, which is opening March 30th, 2019. And hello, Jean, how are you?
I'm fine.
Thank you for being here. Just for the record, what's your name and your hometown?
My name is Jean Davis, and I am from Cookeville. Although I was not born in this county, but I moved here when I was a very young child, so I really consider Putnam County, Cookeville, my home.
Well, that's good because we enjoy being able to claim you as well, so that's good. How long have you been in the nursing profession?
Well, I graduated from nursing school in 1958 and was married right early at that time, and we started our family. So I had two young children, one born in 1958 and one born in 62. So for a few years there, I was working part-time as a nurse because I was trying to get those little ones up, big enough to go to nursery school, etc. So after that, I started working full-time, and I've worked several different jobs. I've done everything from surgery, working at the hospital, our hospital when it was quite small, and when there were very few RNs in this town or this county. And there'd be sometimes a few times I would be the only RN in the entire hospital.
Wow.
But had excellent practical nurses and nurse aides, so that's what made it go. But anyway, and I did that for a while, and then I did some teaching at the high school with health occupations. It's introducing young men and women to nursing. And at that time we got to do something really exciting, which they cannot do now due to, I'm sure, laws and regulations, so forth. I got to take those young men and women to the hospital a couple of mornings a week. The class would be from 8 to 12 each day, and a couple of those days we would go to the hospital, those half days, and they got to go alongside a health giver and a caregiver, and so they were learning about what nursing was about and healthcare.
Wow.
And so that was a real exciting time. So I did that for 5 years. Then I went to public health, and then that was that job was seeing everything in our clinics from womb to the tomb, I'll say, because we saw lots of people. And home care was for those elderly people or disabled people or sick people that the doctor would be referring for to teach and help manage their care at home. And so that went on for 19 years, I suppose. And then I then went to my last 5 years before I retired was at Tennessee Tech Health Service. And that was really a joy because, of course, mostly a healthy population, but there were ways to do a lot of prevention, a lot of teaching. So anyway, I had 30 years of probably nursing in the various fields, so I feel really fortunate that I got to do all those different things.
Yeah, and all of that was here in Cookeville.
Yes.
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 Well, that's wonderful. So starting with the hospital, the differences between when you started at the Cookeville Hospital and to what Cookeville Regional Medical Center is now has just, you've seen massive amounts of change.
Oh, yes, massive amounts.
Yeah.
Yes, well, and regulations, laws, etc. have changed too. So, but it's been for the best, of course.
Yeah.
We're much more educated, much more knowledgeable about health issues than seemed that we were then. Although things were being discovered, medicines and treatments being discovered.
And the technological advances.
Oh yes,
just
yes,
through the roof.
Yes.
We've got some of the most cutting edge things that happen in Cookeville now that we could have never imagined 30, 40 years ago.
That's right. And I would be very lost if I walked in there and tried to use all those treatments for the machines and et cetera today.
Well, and that's with any, especially a very technical field like
Yes.
nursing, you take a step away for even a very short amount of time and things change
Yes.
rapidly. So, what to you were the best parts of nursing?
Oh my, that's a hard question, but there was many.
A lot of good
A lot of good parts and some sad parts. But, there's just so many things you use, skills that you use in nursing, besides just the technical things with your hands, giving the injections or the dressings or whatever. But there's just a lot of psychological needs that patients have and support that you've got to do. In fact, in my latter part of my career, I went to Tech and got a master's degree in counseling. Which I don't know why, I just wanted to do that, because it was just, I could see that was so helpful, because there were so many patients and your family and friends. They need your support. And so
what a wonderful thing to do. For that aspect of that patient's whole health, to take care of that part of them too. Well, and we kind of talked about this already, but one of the questions I like to ask are, what are the biggest changes you've seen since you started?
Since I started, one thing that comes to mind is the uniform. As you've seen from pictures and so forth, of nurses of long ago would wear a white uniform and a white cap of some sort, which would signify the nursing school from which they came. My cap was looked almost like a flying nun. And of course we had to wear white hose, white shoes, and that white uniform and that cap. One funny thing that happened about that cap, just a few years ago, we were invited to a hat party, and so to wear a crazy hat. Well, I mean, I had no idea so I thought, I'm just going to wear my nurse's cap.
Oh, how great.
Well, do you know, most people there were much younger than my husband and myself, and some of them didn't even know what it was. Because, you don't see a nurse with a white cap on.
Yeah, and that white from head to toe, nursing to me doesn't seem like the most practical option for a profession.
Absolutely.
Like nursing.
It'd be much better if you could have on scrubs. But we had to wear, white uniform. When in public health, we did not. We wore navy slacks and a white shirt, and then in the summer we had a lighter clothes, like a pinstripe blue and white thing. But that was I guess the big difference was the uniform.
Yeah. Well, thank you so much for coming in. It's so wonderful to have someone like you from our community that has seen such a span of time and has given herself to a profession like nursing. And so thank you so much.
Well, you're welcome. It's gone so fast. I didn't realize it until just a few years ago. I thought, where is the time gone?
Well, thank you so much. And thank you for helping us with the exhibit.
Oh, well, you're welcome. It's a joy. Thanks.